Thank you so much. Again, to all the colleagues in China, the Great Wall meeting, and my colleagues, Dr. Fuster and the other editors-in-chief, thank you so much for the honor to present. In keeping with what you heard about JACC interventions and JACC heart failure, on behalf of my editorial team, I'd like to give you a quick update. As you know, JACC Electrophysiology is one of the relatively newer members of the JACC family of journals. We are the second administration. It's been around only for 8 years. And the journal, of course, looks at the entire spectrum of electrophysiology, all the way from molecules to humans to in silico, seeing the whole spectrum of electrophysiology. We're very interested in taking a comprehensive look at the field. And we would like to bring information that is very relevant to clinical practice with a big focus on science and prevention. And of course, we talk a lot about interventions and what we can do today, but also to keep the big picture and something that makes people think. In keeping with the philosophy of the JACC family of journals, JACC Clinical Electrophysiology is a global journal. Our associate editors span all continents. We work very closely with, as you know, China. JACC Asia is very special, but we also have a very close link with Asia Pacific with one of our AEs from Australia, and we very closely link with all the professional societies in EP. These are our editors. What is new in JACC EP in the big picture? We have focused on simultaneous publications at ACC, HRS, the American Heart Association, and just this last week at the Asia Pacific Heart Rhythm meeting. JACC EP has increased its publications. In 2023. We are bringing out 15 issues. We bring out at least 12 issues a year, but this year, year on year, we've seen an increased submission to our journal. We are proactive about author engagement, trainee engagement, and I think it's especially important in a global perspective, especially in the Asia Pacific region. We are very, very focused on early career representation, and we also have a special feature in our editorial board where we have scholars in residence, which is early career faculty who are given exposure to the editorial process. In terms of what the journal has brought in as features that are new, all what is listed in this slide have been brought into clinical practice, increased translational science content. We publish a lot of first-in-human studies. We have worked on the central illustration analogous to what you heard from Dr. Moliterno. We are also doing something very special for interventional fields in the sense we provide 3D PDF files, which you can electronically manipulate, and also printable stereolithography files so that you can print a 3D object to look at it. And there's this collaboration with JACC case reports and the other JACC family of journals. We host virtual journal clubs. And as I mentioned before, we are linking with authors at the protocol stage of some studies. So let me highlight the fact that the simultaneous publications have been a big hit. Let me give you a quick overview of what we saw this year. Basic science is a very big feature of the journal. Of course, for me as a physician scientist, it's close to my heart. Here is a quick flyby to show you a very fascinating paper which actually shows that the pacemaker of the heart, the sinus node, is not just a small set of cells that generate an impulse, but the sinus node is at the heart of it, at the core of it, is continuously active electrically. And what we see as a P wave and a sinus rhythm originates only in the peripheral parts of the node. And here is a beautiful study that actually shows that in this middle panel, if you look at it, the signals show continuous electrical activity at the very center of the node. And it's only as you get to the periphery of the node and rhythm emerges. And we already know that with heart disease, especially like heart failure, there is, instead of the superior part of the node, the inferior part of the node takes over. And many of these phenomena for the first time are being published and highlighted in the pages of JACC Electrophysiology. What about translational science? Translational science is a very interesting feature. Here is a paper that was published from Asia Pacific. This is a paper that came out of Australia, and the author of this paper was awarded the Young Investigator Award of JACC-EP. And what this particular study shows is something really fascinating. Ablation is not the final answer for atrial fibrillation. Yes, we are going to do it, it's going to be present. But the big mission is to do the science and understanding how to prevent the disease. We already know that there are many clues from various scientific studies that control of obesity, control of risk factors, avoiding alcohol, high doses of alcohol for sure, prevents atrial fibrillation. Therefore, atrial fibrillation should be seen as an expression of multiple other diseases and not just looking at the rhythm and trying to work it backwards. This particular study actually shows that in patients who are very carefully studied, there is an abnormal control of the atrium by the neural reflex, especially the vagus. And what these authors very beautifully show is by using low-level vagal stimulation, they were able to actually reverse and reset some of the abnormal autonomic parameters that were pro-rhythmic. So this is a little bit of a window into the future of what we are going to be seeing in the field of arrhythmia biology. Moving ahead, a quick word about clinical science. This is now and present, but it's exciting for the journal. Some of the fascinating clinical work that has appeared in our journal include explanations for arrhythmia syndromes. Here is a human study, which is always very, very valuable, of patients. And this is a study, of course, it's a collaborative study with by a group in Europe with a team in Asia, which actually shows the mechanism of arrhythmia in humans. And this is actual mapping of humans intraoperatively, which actually shows that the explanation behind the early repolarization pattern causing ventricular fibrillation is actually due to micro scars in the heart. Again, the study of these kinds of diseases with very nice mapping helps you become a better clinician. So this is information that is relevant to all cardiologists. So one of the big features that we've been highlighting, this is a vision that Dr. Fuster has inculcated for the JACC family of journals, is to get the central illustration. Here is a central illustration that tells a story and puts diseases in perspective. So if you look at how you detect heart disease on the y-axis, and if you look at the severity of structural abnormalities on the x-axis, you can see that as you cross various thresholds of being able to detect disease, you can pick that up on the ECG, and the imaging studies follow a pattern. So you can go all the way from no structural abnormalities to very severe structural abnormalities and everything that lies in between. So early repolarization pattern, Brugada pattern, arrhythmogenic RV dysplasia, and extreme forms of RV cardiomyopathy, which is Uhl's anomaly or parchment heart. So you can see that science has to be integrative. Clinical medicine has to be integrative because no two patients are perfect copies of each other. And we'd like to always keep the excitement of clinical medicine alive in the pages of our journal. Clinical trials inform all what we do. This has been a big feature of our journal, and we have published some of the most important EP-specific device trials. Here is the study, which is the PRECEPT trial that was published. And this, of course, had a big impact on the choice of catheters we used for catheter ablation of atrial fibrillation. And again, drug refractory symptomatic persistent AFib, which is a bigger subgroup of patients with atrial fibrillation, and the treatment using catheter technology has been highlighted, which of course is true for interventional journals. Finally, a tip of the hat and a flyby to talk about the ever-increasing importance of physiologic pacing. And in fact, with each passing year, it's become very obvious that you shouldn't just place, pacing leads which are non-physiological. And we are soon going to get to a point where RV apical pacing will become an anachronism. What has really had a big impact in the field of clinical management based on our interface with heart failure specialists is, of course, cardiac resynchronization, specifically the emergent importance of left bundle area pacing. This is a big shout out to our colleagues in Asia, especially China, which has resulted in completely, a revolutionizing of this field. Dr. Weijing Huang and others have published very important studies which have given us a completely new approach to how we approach physiologic pacing and the bundle area pacing. No presentation of the journal would be complete without a quick overview of journal numbers. Thanks to the support of all our colleagues around the world, year on year, the submissions for JACC-EP have gone up. And in the most recent year, we received over 1,400 submissions. Our acceptance rate is still at 15%, but this is with a much, much larger numerator. And we get papers from all over the world. China ends up being an important, it's almost now second only to the United States in the number of submissions. So it's a big shout out to the fact that science is supported in a very big way in China and Asian countries, especially China. The journal numbers, our alphanumeric scores are increasing, and of course our impact factor continues to be one of our highest impact factors. Was recently received, and the journal is doing well from those perspectives. It's an imperfect way of judging a journal, but be as it may, it's available, and they track the overall. What is important is the impact of the papers we publish. I'd like to finally conclude by stating that the journal itself looks at all its readership, the clinicians, electrophysiologists, and other allied specialists who may look into us because it's now a JACC is a family of journals. We look at teachers, and we also look at the investigators. So it speaks to all these audiences. And we have spent a lot of time looking at sort of the workflow and how the journal should be a place where we use it as a portal for knowledge. I'd like to, in the last two slides, highlight a big important vision that has been highlighted to us by Dr. Fuster, and that is a very tight integration with the JACC family of journals. So this is a huge plus, and in my first 2 years of editing this journal, I've been very, very impressed by the collegiality and the mentorship, and especially the guidance given by Dr. Fuster as sort of the head of our family. So a special thanks to all of you. And again, this is the second time we've had a chance to present to our colleagues in China, especially Dr. Wong, who's physically there at the meeting representing the JACC family. I'd like to conclude with one slide, and many of my Chinese colleagues know this. My favorite Asian country to visit is China, and historically, it's such a beautiful place. China always has had a global outlook, and we are back in the 21st century at a time when a lot more global outlook and tight integration is needed, because science and patient care and especially clinical care and clinical sciences unites the world. I'll stop here, turn it back to the authors, and glad to take questions. Thank you so much.